Hello, I'm Dr. William Streck, President of the Bassett Healthcare Network, and I'm here to provide an update to the community about the COVID-19 pandemic that is affecting our region. The Bassett Healthcare Network moved proactively to address this emerging problem, setting up a hotline, screening tents, and other modalities to ensure that patients and concerned parties could get necessary information, treatment as required. All of that has worked quite effectively. We've had 8,000 phone calls to the hotline, and then going through this cascade, we have ended up testing 1,700 people with about a number less than 200 proving to be COVID positive. So we have controlled that phase of it fairly effectively. From this population, there have been some patients who have required hospitalization. That has been managed as well. The sum of this is that we have been able to manage the issues with the COVID crisis without exceeding our capabilities. And so now as supplies come more readily, as ventilators are available, as New York City stabilizes, we can assure the community that we are in a situation where we anticipate being quite ready to handle any major issues attendant to the COVID-19 situation in our region. And I can add that it appears there's been a slowing of the curve, a modification of the illness manifestations. And so it looks as though, in an optimistic format, that we're at perhaps have passed the midpoint of this particular surge. That would be a favorable interpretation, but the data around the region as well as the Bassett experience suggests that there is at least a plateau, and that is a positive sign. With that in mind, we have to look ahead, and so at the Bassett Healthcare Network, we are doing just that. We have to anticipate that there will be a full return of other services that we provide at the various hospitals and at the medical center, that all our clinics will be open, that we can serve our patients. That process of planning is now underway. Even as we do that, we, as you, must remain cognizant of the fact that COVID-19 will persist in our communities for some time, so that we are planning on two tracks, one to address that problem even as it diminishes, and the other as we prepare to return to the full provision of services that we are privileged to offer this region. So that is essentially the message. Stabilization, progress, but still disease. So the message that goes with that is continued hand washing, continued social distancing, and if you have questions, our hotline remains available to you. But overall, there has been progress. We do not anticipate that we will be limited in our resources to provide care. We will continue to do so even as we plan for the future. Thank you.